Hello everyone, I am Dr. Francisco. Let me adjust my screen. Thanks. Okay, so what can you do to take better care of your high blood pressure? This is part one. For those who tune for the first time, I am Dr. Francisco. I'm a specialist nephrologist and a transplant immunologist working at Francisco Kidney and Medical Center in Singapore. And this is the bite-sized information for kidney and related diseases. This video blog is destined to help patients with kidney problems or at risk of kidney problems, for example, having diabetes or high blood pressure, to be better informed so they can take better control of their disease, minimizing worries, and to take better decisions with their own doctor or with me if they choose me, so they can minimize complications. So, what can you do to take better care of your high blood pressure? First of all, my first recommendation is buy a blood pressure machine to monitor your blood pressure at home and ask your doctor to teach you how to use it. It is an extra cost, but it is an important investment in your health. By monitoring the blood pressure at home, you can, for example, identify increments in your blood pressure early and seek medical advice promptly rather than waiting for the next appointment in whatever months it is to discover your blood pressure was high for the last months, whilst causing some damage to your organs, and many times irreparable. And number two, to roll out wide code hypertension, where your blood pressure is high in the clinic but normal at home. And because you don't expect most of the time in your clinic, so if your blood pressure is at home, okay, maybe there is no too much point to do dramatic changes. So your doctor might not need to increase your medications based on those clinic readings, but based on the home readings when you normally are and you are displaying your normal activities. Number two, to take your medications as prescribed by your doctor. I always have stressed that. Indeed, with your condition might need medications. If not, the medications are not working as well. Your blood pressure might not be as controlled as well. Or sometimes I have seen many patients just take them randomly. They forget, it happens. But sometimes they say, oh, maybe I don't need it, or I feel okay, and they don't take it, but the blood pressure is high. They maybe feel okay, but the blood pressure is high and causing damage to many of their organs. Or sometimes some patients, monitoring the blood pressure is good to get an overall gauge of how you're doing, but some patients will say, okay, now if my blood pressure goes a little bit high, I take the medication. If not, I don't take it. And sometimes that could be okay, but most of the time it's not, and they just cause joyous in the whole blood pressure, those high spikes, and then the blood pressure goes low, high spikes, rather than the best is to try to adjust the medications, dosify them correctly, maybe dosifying certain times on the day versus others, or split the dose, etc., so that you can get a blood pressure as stable as possible throughout the day, and ideally also to be controlled at night. So bear in mind that. So like even that you take the medication when you're okay might not be all right, because this damage in many patients is silent, or your blood pressure might be high and you don't feel anything. And second, it predisposes to this yo-yo with high spikes of high blood pressure that still is damaging to your body if you just take them randomly on when you think as needed. Indeed, there are occasions that we prescribe a patient stable medications for control of blood pressure to maintain it, and in some occasions where the blood pressure might shoot up, for example in dialysis patients or other patients with more unstable high blood pressure, then we tell them in that case you take this extra if necessary. But it's not just taking the baseline randomly or when you think is necessary. Like you take a baseline, and if one X day something goes beyond expected, you can take that. That is a little more strategic. Remember, one of the crucial things of my care is also self-care, so I'm telling you that, but also being strategic, not just react or random do things. No, have a plan. If this happens, is the next. If not, and if I don't know, that's why you have a doctor. Communicate with a doctor or communicate with me, yeah? Number three, aim to high to have a high blood pressure that is at least less than 140 and 90. There are many different numbers recommended by different type of guidelines doctors, and depending different conditions. You just need to ask your doctor what is the right for you, but overall your blood pressure should not be higher than 140 over 90. um, Obviously, if one day is the more stressful, or one in a while some spikes higher than that, is not going to be highly damaging. But if it is most of the time higher than that, probably you need to do something about your sodium in the diet. You might need to lose weight. You might need to take extra medications, etc. But consult your doctor, and also a little high blood pressure, or a little higher blood pressure can be allowed in certain patients, for example elderly, because they are more prone to shifts in blood pressure and falls, and you don't want to fall to anyone, but you don't want to fall into an elderly person, because that person is, more prone to severe consequences out of the fall, because the reaction time to put, to stop the fall is not as great when in a younger person. Also, the muscles, the bones, the joints are not as strong, and if you hit any bone or hit the head, the consequences are greater, especially that many patients might be taking blood thinners, etc. So it's a combination that you should try to minimize the risk. So for that, a little higher blood pressure is allowed in elderly or patients with, a risk of hypotension, maybe having a severe heart problem, etc., or a risk of falling, having, not a great dexterity and mobility, or patients with hemodialysis, because during hemodialysis, with the shifts of fluids, the blood pressure tends to drop in many patients. So if it's already super well controlled, and it can drop into a dangerous situation, or the patient might feel uneasy, unwell, with dizziness, cramps, or just not feeling well. So for that reason, a higher cushion is allowed in patients that are higher risk, like the ones I mentioned. If any doubt, consult your doctor or consult me if you want. Yeah. And number 4, avoid very salty food, and reduce the amount of salt added to your food. This can actually improve the blood pressure in many patients, because the salt sort of helps retaining fluids, and the fluids are not only retained, in the legs or anything else. So expand the volume, the fluid inside the blood vessels, where the pressure is maintained, or where the high blood pressure exists, if you have it. So you don't want that to be, the fluid content there, to be expanded, because it's higher blood pressure there. No? So, and one of the strategies is to minimize salt in the diet, so to reduce the fluid and reduce the tension of the blood vessel. So if you have excessive weight, or much more than that, aim to lose weight through diet improvements and exercise, because it's a higher load to the body to pump to a higher body size. So the heart overworks, it has to pump harder. That increases also the blood pressure, for other metabolic consequences. And also many patients, usually with excessive weight, also tend to eat a little bit higher sugar diet, a higher salt diet, etc. It's multifactorial, but losing weight can improve the blood pressure in many patients, and even reduce the need for antihypertensives in many patients. I've seen patients that have lost weight, and suddenly they don't need to take that blood pressure tablet, or they can minimize the medications. Yeah. Number 6, if you smoke, sincerely stop smoking. I'm not going to stress too much today, but I'm a very pro non-smoking, because it's the single risk factor highly associated to, with a lot of cancers, medical problems, shorter life, etc. So I know it's not easy, but if having difficulties, there are methods, and there are specialists. So remember, all the the toxins from smoking, apart from affecting your lungs, your heart, and many other problems, give you risk for cancer. Damage also the blood vessels, and for that the blood vessels, healthy blood vessels are also important to control the blood pressure adequately and to avoid consequences of blood pressure. If it's already damaged, more chance of deposit cholesterol there, and more chances that you probably can, have a heart event, heart attack, and things like that. So it's something that you don't want. So sincerely, if you have nothing, stop smoking. If you are 15 years old, you should not be smoking. If you are 18 years old, you should not be smoking. If you are 21 years old, you should not be smoking. If you are 40 years old, you should not be smoking. Whatever your age, just stop smoking. Whatever your disease, stop smoking. If you are healthy, even if you run, you play football, you smoke, stop smoking. It's the worst thing you can do to your body, and unfortunately is legal and is allowed and is not banned. For example, we have heard things that ban chewing gum, etc., but smoking is not banned. So it's something to reflect on. Okay, so have your heart check is number 7. As many patients, the high blood pressure can affect the heart. High blood pressure, high blood pressure on heart, and all that are interrelated. So the ECG, the electrocardiogram, is a good initial test. But if you are having some problems, or you think you're a high risk, or you're a higher risk, you know it, you might need extra tests. Consult with your doctor if you need it. But at least no harm to get your heart checked at least once in a while. Number 8, do at least light moderate exercise several days a week. Especially if no heart problems. You have problems, heart problems, probably better consult your doctor and experience a physiotherapist. Exercise also help you in many other aspects, but even people with heart problems can still do exercise, but has to be prescribed, especially by the heart doctor. And but definitely, if you start doing exercise on your own or guided, and you start having some chest discomfort, some shortness of breath, feeling dizzy, or your blood pressure goes sky high when you do exercise, probably you should consult your doctor and stop doing it until you get clearance from your doctor. Yeah. Number 9, patients with heart problems might benefit from the use of aspirin. But remember, consult first your doctor to see if it's good for you. Don't just go and buy it, because there could be people who is allergic, people who can are more predisposed to bleeding in the stomach after taking aspirin, or can potentiate the risk of bleeding if taken with other drugs. So or you will be undergoing a procedure soon and you start taking aspirin, and if you don't tell your doctor, you could be at risk of bleeding, or the procedure has to be canceled because you were taking aspirin. So although it's over the counter, etc., do consult your doctor if that's important, necessary to you. Yeah. Probably we can leave it here, and then we carry on next week with part 2. If there is any question now, you can put it. If not, you can leave it later in the comment section. If you like this, if you find this useful, please give me thumbs up, meaning put like, and share with your friends or family the existence of this group. At the end of the day, all of this is very simple advice, but if practiced, the consequences are magnificent. The problem is, people say, that's so simple. I already know it. Oh, my doctor already told me. Oh, my grandma is what always they told me. But they don't take the conscious effort to incorporate in their lives and to say, oh yes, it's simple. But actually, the fact that it's simple is even much better. You don't need to be a magician. You don't need to be a superhero to do it. You just need simple things. Just reduce a little bit your salt. Just buy a blood pressure machine, $50. I've seen offering $40. So in a way, it's not that cheap, but it's not that expensive when you take into account what it can mean to your life. It's much more expensive spending thousands of dollars of that admission for a heart attack, or for your blood pressure when it's sky high and you could not breathe, or you feel anxious, that spending $40 and control it very well at home. You know what I mean? And other advice like eating less salt or eating less oily food, whatever, you know, it's simple to do and actually won't cost you much, and even you can save even money, you know, if you moderate your diet, etc. No, so just all these, if combined and applied, the results you can obtain will be compounding and you will see the benefits. The problem is human nature, that we just expect a magical, no, oh, I expect the doctor to give me the medication number 61XXX that will cost me $1,000 a shot, and that will cure my hypertension or my diabetes, or that way allow me to eat whatever I want. That medication don't exist, and if it exists, it's going to have a lot of uh, consequences, cause not being a healthy one, just tackling only one single aspect, not many other aspects. At the end, for controlling your diet, your lifestyle, you receive specific benefits, and so many benefits that you cannot even imagine. Uh, Even that you don't feel them, but you are start getting around in health. You get better nutrition. You boost all your body, your cardiovascular system. You do exercise, your respiratory system, your muscles, your joints. You improve certain metabolic uh, parameters, etc. There are many things you can get from diet and exercise that you can never get from a pill that can help you to lose weight or control your blood pressure. And on the contrary, you can get side effects, costs, etc., interactions, uh, etc. No, indeed, many patients do it. I'm a doctor. I have my clinic. I prescribe medications, but I always give them the opportunity and give them the room to do diet and lifestyle changes, because they are impactfully practiced. And as I told you, you don't need to be a superhero to be able to do it, and they don't need to be dramatic or drastic, undoable. Any mortal person can do it. I did it. I lost 10 kilograms. I have maintained it for 3 years. Just by one day decided that this is the right thing to do, that this is what I want to do now for my life, and embrace it happily. And then the change is happily acquired. I didn't resist it because I knew it was the right thing to do at what I wanted to do to achieve my goals and my dreams in life. So if you see it from that perspective, you might be a little more convinced to do the necessary thing. So I am Dr. Francisco, wishing you the best possible health. You need my help, you know how to contact me. Take care. Bye bye.